Good morning, everyone. Nice to see you all. Very nice to see you all this early in the morning. I am really pleased to be part of the WorkSafe team that's welcoming you here and hosting this information session on caring for people with dementia. I've just joined the team. It's about 3 months. Previously, I was with the Vancouver Olympic Organizing Committee, and it's been quite an interesting journey for me to come here and to work with an organization that cares about the safety of everyone, and through that caring is interested in teaching those of you who care for people with dementia ways to work more safely. So we've held these kinds of workshops previously, and as a result of the call to action that we've received in this area, we determined that it would be a really good idea to hold another set of workshops. And looking at the turnout so early in the morning, I think probably it was a good idea and very timely. So why is WorkSafe putting on sessions like this? Why are we here? It's not always an obvious reason. Well, the main reason why we are here is that 1 in 10 workers in residential care is injured every year. 1 in 10. And 80% of the residents in residential care are individuals with dementia. So when you look at it through our lens of dealing with workers who are injured while they perform their work, it makes good sense for us to better understand how you could work with people living with dementia, how you could work with them safely. So by providing you access to advice, expertise, and good practices in the care of these individuals, we hope that you and people who work around you and with you will be able to work safely, and that overall will reduce injuries in your workplaces. That's our goal. That's very important to all of us. So individuals with dementia, you guys know this better than I am not an expert in this area, but individuals with dementia find their ability to communicate diminishing over time, diminishing more and more, to the point where they may be unable to express their needs, and they can become anxious, frustrated, angry, and fearful. These emotions that they experience can cause them to escalate their behavior, such as hitting or kicking, biting. And often the person that experiences that is their caregiver, those people around them, or their family members. And within healthcare, this is the third most common cause of injury, violence in the workplace. And these are individuals who need your care. So we believe that by better understanding the illness that they are living with, and better understanding your reactions and ability to work with that, we should be able to reduce your experience of violence in your workplace. I also have a personal reason for being here, not just because I work with this wonderful team and have joined WorkSafeBC, but I have a mother who's living with the illness of dementia. Presently, she is still living at home with my dad, but we're going through those early stages to middle stages of increased loss of memory and of functioning. And we're going through those phases of the family questioning, what is our next step? What should we do? And we fear the transition to residential care. We fear it because we're worried that our mother will be angry with us, and that we'll feel guilty, and that we'll feel sad. And one of the reasons I'm here today, and I'm going to stay and listen to the speakers that we have today, is so that I can learn what that transition is all about, and I can learn how you as residential care workers, how you value individuals like my mother, and how you'll take care of people like my mother, because that matters to me. The deeper your understanding is with this illness, the better you'll be able to ensure your safety, but you'll also be able to ensure that people like my mother are cared for the way I would like them to be, with dignity, with respect, and with loving hands. Let's start our day with a short video that sets the stage for safely caring with people living with dementia. So as you can see from that video, it is very important that we understand this illness and we understand how to work safely and respectfully, respecting both individuals that are involved. Well, I'm very pleased to introduce the first speaker and initiate you to a very nice array of very talented experts that will be talking to you and teaching you. The first person on the podium to broaden your experience is Jean Blake, who is the CEO of Alzheimer Society of BC. Jean leads a team of dedicated staff and volunteers to promote awareness about Alzheimer's and related dementia. She's also an advocate for improvement in the dementia care, support research, and to find the causes and cure of the disease. She's also involved in research that's looking at ensuring that people living with the disease and their family have help for today and hope for tomorrow. I'm very interested in learning from Jean. Please welcome her to the podium.
High enough? Okay, I think we can put that there. All right, thank you. Thank you, Donna. Okay, well, that was quite the way to start the day. I think just in retrospect, it's always interesting to debrief those kinds of incidents. So I know we've got some experts on the panel, on your speaker list later on. So I've been tasked with just setting the stage a little bit in terms of the alarming rise in numbers. And the Alzheimer Society of British Columbia is a partner along with the other 9 provinces and a national office. And we commissioned together this report called The Rising Tide. It was really in response to very dated information that policymakers were using across the country and in provinces. And it was for us to be able to influence dementia care, improvements in dementia care, we had to provide better information to government and other policymakers. So that's really the history behind it. Do I have control over these slides somehow? I do? Okay, here's the other little... where do I click at? Just here maybe is even easier. I can say next slide too. I mean. Sure. All right. We know that the impact of dementia is incredible, both on the personal side and as the growing numbers are out there. We're also seeing it on the system. On the personal side, we know it's not only the person that has the disease, but also their family, in particular the primary family caregiver. This disease causes more years of disability than any other chronic disease. And so if you happen to be the primary family caregiver, you also are affected by this. We know that because of the length of the disease and the growing severity of it, that it also has an incredible financial burden on the family, on the people living with the disease. And because as it progresses, that need for 7/24-hour care, it also does erode the care of the family caregiver. The system, well, it's been a growing issue, not just here in Canada, but across the globe. And you may have heard the World Alzheimer Day report on the global impact. The number of people living with dementia across the globe now outstrips the population of Canada. So we've got 34 million people here in Canada, and I believe the number was approaching 36 million. As well, the global economic impact is now about 1% of GDP. So that's it's huge. Many countries have begun to address it, and they have dementia policies, dementia plans. we don't here in Canada. So that was also one of the reasons for the publication of The Rising Tide, to bring attention to the federal government and to call for a plan. So those numbers here in Canada, currently 500,000, with no interventions, seem to more than double to over 1 million within a generation. And generation is defined as 30 years. What does that look like here in BC? 70,000 British Columbians. And we also know that partly because of better diagnostic techniques, but there also seems to be an alarming number of younger people. So 10,000 of those 70,000 are under the age of 65. And women, largely because of our longevity and risk, the number one risk factor being age, we make up over 70% of those living with the disease. So the incidence already pretty alarming, about 1 new case every 5 minutes, and again within a generation looking to double to 1 every 2 minutes. The prevalence, currently 1.5% of the Canadian population, and will be pretty close to 3% in another 30 years. We see a real ripple effect of the disease. Again, I talked about the impact on the caregiver, and earlier on, care needs are fairly minimal. Many people live alone even if they're not fortunate enough to have a spouse or an adult child living close to them. But as the disease progresses, so does the need for care. And very few families are able to keep their loved one at home right through till death. It is a fatal disease. There is no cure for it at this point. So we need you. We need all of you, because eventually the person will end up in some kind of care. So care is defined into, or classed into, 3 different types, and that's living at home with no formal supports, living at home and receiving community care. How many of you in the audience are home care workers? So a smattering, okay. And then, of course, closer to the end of life, receiving care in long-term care facilities. How many of you are from long-term care? By far the bulk, okay. We know that though with this growing number of people developing the disease, that there's no way that we can keep up with the demand for long-term care beds either. So those of you who put up your hands around home care, community care, we need to see more of those hands going up too, because that's where the additional supports are going to have to occur. And we know that at some stage, people, as much as we do a lot of incredible work with support and education, that there is some kind of formal health care that's going to have to happen in the home. What we're seeing with caregivers, already a very substantial number of family members providing informal care, and again within that generation those numbers are going to more than triple, and that's an incredible impact on family members as well. One of the other things we did in the report is we looked at, is there any way to stem the tide? And there were lots of things to look at. We looked at what other countries are doing across the globe, what are some of the most successful interventions. 2 of them focused on prevention. We do not know that the disease can be prevented, but we know that perhaps at least it can be delayed, or the progression of it can be delayed by physical activity and by diet and other lifestyle changes. The other 2 interventions that we focused on were supporting the family caregiver. So if you're able to get appropriate supports, training and education, some support with navigating our lovely healthcare system, and it is lovely, but sometimes it's complex. But if you can get those supports, there's research that shows that a family can keep their family member with dementia at home for as long as an additional 1.5 years. So nobody wants to put their family member in residential care any sooner than they have to. If they've got appropriate supports, we can delay that. And so those are big costs to the healthcare system as well, cost avoidances. So there are 5 main recommendations that came out of the Rising Tide study. Whoops, I went a little bit ahead. Research, I mentioned earlier, there is no one cure. We don't know what the causes are either. So there's been some interesting directions taken, but we need much bigger investment. And it's one of the fewer, in terms of when you talk about the years of longevity that the chronic disease affects a person's life, very little money goes into dementia research compared to other chronic illnesses. We need clear recognition of that role of the informal caregiver. You saw the stats earlier on that they need to be supported, and if they are appropriately supported, can manage at home for longer. We need to look at the prevention and early intervention. Early intervention, the earlier we can get to people, the more support and education we can give and hopefully maintain their quality of life for a longer period of time. As well, we've done some wonderful work here in BC. That's not the case across our sister provinces, so we need greater integration of care and increased use of chronic disease prevention and management. And strengthening Canada's dementia workforce. That's part of why you're here today. We know that dementia is not a very well understood disease yet, and a lot of what we understand about it has really occurred in the last 10 to 15 years. So I do see a lot of younger faces. I know that you're not getting a lot in your curriculum yet, and so that's another place where we need to see how we can make a difference. What do we do as a society here, Alzheimer's Society here in BC? Well, our ultimate vision is to create a world without Alzheimer's disease and related dementias. And what we do is we work to alleviate those personal and social consequences of Alzheimer's disease and related dementias. And just a lot of people get confused about the term Alzheimer's versus dementia. Dementia is the all-embracing term. Alzheimer's is the most frequently occurring form of it. And we were formed by a group of grassroots volunteers whose family members had Alzheimer's, and so that's why the name sticks. Our three priorities going forward, we've got lots, but those are our top three. Really early intervention, support for the family caregiver, and education both for the family and for the professional caregiver. And here's one of the faces of dementia. This is Jim Mann. Jim, are you in the audience? Might be here this afternoon. Jim is one of our most powerful advocates. He's a person living with dementia. He was diagnosed at age 58. I think he's 61 right now. And he was actually an advocate for the airline industry. He did a lot of traveling. He started having trouble in airports, couldn't find his way around. Went to his doctor quite a few times before he finally got a diagnosis. And this is just a quote, not from Jim, but from someone else that lives with the disease. It's really hard to get a diagnosis. And so that's number one is we're working on. We want earlier intervention. We want early diagnosis. And we know that that's partly because GPs they don't have a heavy caseload with people with dementia, although you heard those numbers, 80% of the residential beds now are filled by people with dementia. So I'm sure that's on the increase as well. And we are working with the Ministry of Health to do some work around physician education as well as with other health professionals. We also know that caregiver issue, that it's a non-visible disease. And so often if you're caring for somebody, you don't get the same care and concern as someone who's dealing with someone that has cancer or cardiovascular disease, or it's not visible. And formal care. You heard from Donna earlier. These are our mothers, these are our fathers. So when you do have to give up being able to care for your family member, often that's an even more difficult grieving process for the family than death. It's a very tough decision. And so when they do have to give it up, they want to know that those hands that are caring for them are caring for them with love. So what do? We do have a really exciting... I have to keep clicking to get the picture up. Sorry, you missed that lovely picture of the couple before. We have an exciting new program. We've trialed FirstLink in Victoria for a couple of years. It's actually based on a program that's very available in Ontario, and it was originated in Australia. But it's really a first response strategy for people that are newly diagnosed. It's got 5 components. The partnering is with the health authorities. They work to provide us with speaking opportunities, getting in front of health professionals, not only GPs, but case managers, nurse practitioners, people that work in geriatric outreach, anyone that could do, even emergency rooms. Sometimes people present for some other reason, and an emergency room nurse might realize that, oh, this person likely has dementia. So we have now a formal referral process. It's not available everywhere yet. We've expanded this year to 5 additional sites other than Victoria, so Nanaimo. As VHA, Vancouver Island Health Authority, has been very supportive. We started a second location there. Vancouver Coastal, we're only in Richmond. And Fraser, Burnaby, New West, surrounding area. In the interior, Kelowna and that upper Okanagan area, Vernon, Salmon Arm. And in the north, Prince George and some surrounding communities. And there we're going to try out some technology as well, because the population is fairly sparse, and how we can work with their video technology in terms of accessing people. So we have staff that do a proactive outreach, and this is again one of the real winners. The families, when they get the diagnosis, that's pretty tough. So it's like, what do we do? And we have somebody actually calls them, makes the connection, and says, I can help. So they establish a relationship, they get together, they work out what the society's programs and services may be beneficial, but also other community supports, and they do follow up. We can handle about 400 families, new families a year. Cost is about $500 a family. $80,000 is the average cost for a residential care bed here in BC. So if we can even keep them supported for a little bit longer at home, there's a good cost avoidance issue. Minds in Motion is also being rolled out along with that. One of the things we find is that people can be quite physically active as the disease progresses, but their bodies remain healthy. So this is a program where we've got both a fitness and a social engagement, and we're able to rebuild some of the social networks that people lose as family and friends, other family and friends sometimes back away. We also do a 6-part program, need to close up here, for both the person with dementia and the caregiver, and as the disease progresses, other education for the caregivers. We do a lot of advocacy and government support work, and one of the things that you may be most interested in, and have a look at it on our website, is a position paper about culture change in residential care, transforming institutions into supportive places to call home. There's pieces for what managers need to do. How many managers do we have in the audience? Great, because it starts with you influencing some of the policy changes, what staff are allowed to do, how much time they've got in terms of working with clients. And we have a second one because often people do end their lives in your facilities, and it's called Caring for Persons with Dementia at the End of Life, and it covers some key areas, both the physical and the psychosocial, in terms of assisting people, and also really around some of the decision making that needs to be put in place. We try to do that in our programs early on to make it easier when it does get to end of life, but there are some things that you as a facility can assist clients with as well. And research. This is a frightening disease. We've seen it in our parents, our spouse. We don't want to see it happen to us. So we also, with our partners across the country, fund a lot of research. And I'll just close by saying again, you can really help to make a significant difference in the help for today as well as the hope for tomorrow. We do have a display over there. This is my contact information. There's also a flyer where you can access, it gives you information about our website and how to access our supports as well. Thank you very much.